Hello everyone, welcome to our case on brain aneurysm coiling. What is a brain aneurysm? Well, it's a sac on a blood vessel that can rupture, and here the AHA shows us a nice picture rendition of what happens when the aneurysm ruptures. And this has happened to actually some rather famous people, such as Emilia Clarke, who played Daenerys in the Game of Thrones. She had a ruptured brain aneurysm. And we're going to present a case of a 40-year-old woman who presented with the compression of a cranial nerve from her aneurysm. Here I put a little circle where the aneurysm is on her. And this nerve controls the eyelid and the pupil of the eye and also the muscles that go to the eye on the left side. So those were the symptoms that she actually presented with. She had double vision because her eyes didn't align appropriately, and she had an enlarged pupil and her eyelid was sagging. This is a CAT scan angiogram which shows her aneurysm, and it's rather circular, you see here. And then on the angiogram, you can see that it is truly like a ballooning out of a blood vessel, and I labeled it there with some red writing. So what's really cool about coil embolization of brain aneurysms and how we actually use endovascular techniques is that it's rather minimally invasive. There's a little micropuncture of the radial artery in the patient's wrist, which you just saw us get access to right there. And we use this extremely tiny wire to get access to that artery, and then we get bigger wires and catheters then over that small wire, which eventually gives us really good access. And here we go up the right vertebral artery, and there's the intermediate selective catheter giving us access, followed by the guide catheter. And we're going to put that up basically at the bottom of the patient's skull, and then we do the injection, which shows the aneurysm there. And the software and the technology we have is really cool. We basically can make a run of the contrast going through the blood stream, and then we can make a map, which you see here, which is why it's kind of whited out there. It's a map of the patient's blood vessel. And now we're putting a coil into the aneurysm. I sped this up, particularly because it does take us a little time, and we like to be delicate. But we did want to show the coils going into the aneurysm, and so you put one in, and then you put another in, and as long as you can still keep putting in a coil and it feels safe and it feels good, you keep putting more coils in until you feel like you've sufficiently packed the aneurysm with the coils. And coils are made of platinum. They are extremely soft so that they can be delicate going into the aneurysm. And here was really interesting. We got into a really tight spot there. The coiling catheter had left the aneurysm while I was trying to still put a coil in. And then being really careful and really gentle and not losing control and just being really calm, I was able to sneak that catheter back into the aneurysm and finish coiling the aneurysm. And it went really nicely. And I really kind of snuck that catheter deeper into the aneurysm once I got back access into the aneurysm. And that really made it so that coil, that last coil, was able to be implanted into that coil mass nicely and safely, resulting in really good embolization and filling of the aneurysm. And that's the whole point, is we want to fill the aneurysm from the inside so that it can clot off safely, and then that clot and that coil mass will then heal over and become normal blood vessel. And here you can see our final product shows that the coils are all inside the aneurysm. You can't see the aneurysm filling at all anymore. And this is the 6-month follow-up. Her cranial neuropathy is completely resolved. She's doing great, and this is an awesome case, and just happy to share it with you. Please go ahead and subscribe to the channel. Love to have you hit that button.